Okay. Oh, excuse me. Hello and welcome to Verbling. I'm Teacher Oakley, and sorry for the slightly delayed start of the class. Apparently, I was signed out of Verbling, and I didn't realize I was signed out. If this ever happens to you, you can't figure out why you can't get into class. Maybe it's because you're signing in has timed out and you're no longer signed in. Just a word to the wise from personal experience. I kept opening Hangouts and they weren't attached to Verbling at all. Oops. Anyway, I'm here now. Hello, Verbling people. For the rest of class, we are going to be looking at a very common situation and learning vocabulary and phrasing, types of questions and so forth that are involved with a trip to the doctor's office. We're going to start out looking at some vocabulary and talking about that, and then we're going to do a little bit of role play and practice answering the kinds of questions doctors ask and kinds of things that we say to a doctor. Okay. All right. Hello, Anna.
Hello,
Welcome.
teacher. Good morning. How are you?
I'm okay. Having a crazy day, really.
Oh.
It's been an adventure. Let's put it that way. Anyway, having one of those days. In English, we say, "Oh, I'm having one of those days." One of those days where everything just goes crazy. Okay. Anyway, I'm having one of those days.
Okay.
All right. Hello, Saiban. How are you?
Good, thank you, teacher. How are you?
I'm hanging in there. I'm okay. How are you?
Good. I'm fine. Just it's boring time in Scranton.
Okay. A boring time. Okay. I am bored. It is boring.
I'm bored. Yeah, it's bored. Yeah, of course. It's boring.
Is boring. I am bored. Okay.
I'm bored, and it is boring. Scranton, it's boring.
That's it. Okay. All right. Well, hopefully we can add a little excitement to your life. Hello, Heidi. Welcome to the class. Hi there. Heidi, are you there? Hello, hello. Oh, okay, Heidi. I don't know what's going on. Maybe she's getting the tea or something. I don't know. All right, let's look at some vocabulary, which we're going to be using. This little doctor's role play class. Okay. Anna, what is nausea?
Nausea is similar to vomit, but without vomit. As before, when you feel bad, before to vomit, I think.
Okay. The bad, how can you say that? It's difficult to say, right? The bad feeling that you have, I don't even know how to spell it. The bad feeling that you have before you're going to vomit, the sick feeling in your stomach. So nausea, okay, nausea is the noun. Now, this is important. You might tell a doctor you feel nauseous. Nauseous. For some reason, nauseous is the adjective. And for some reason, nausea, we use a Z sound. Nauseous, we change it to an SH sound. This is kind of a weird one in English pronunciation. We change the sound. So you might tell a doctor, for example, I've been feeling nauseous the last 2 days, something like that.
Yes.
In other words, feel like you're going to throw up. Okay, speaking of which, quickly, let me say hello to Silas. Welcome to the class. Hello, Silas.
Thank you, teacher. How are you?
I'm fine. Am I saying your name correctly? Or is it
Yes, in Brazil it's Silas, but
Silas?
everyone call me Silas.
Okay, well, whichever one you would prefer, I will call you that. I will call you
Silas.
Silas. All right.
Yeah.
I will call you Mountain Man if you want me to. I don't care. I'll call you Superman, Batman.
That's right.
I don't care. Whatever you want me to call you. All right. Moving on.
That's perfect.
All right, Batman. Okay, Silas. Thanks. I'll come around to you. We're going to look at first we're going to talk about some of these vocabulary words we're going to be using in the role play part of the lesson. Saiban, vomit.
Okay, so eject matter from stomach through mouth.
Oh, wow. Okay. Eject matter from stomach to mouth. Wow. Okay. Okay, and very good. Vomit is a more actually formal word. Throw up is the same thing. Do you know any other words, Saiban, that mean the same thing? This disgusting word. Vomit, throw up.
Some of my friends they taught me back in Dallas, but I forget. I'm sorry.
Okay.
I just only know the vomit.
Well, you're in university in the United States. You should have many of these.
Yeah, I agree, but usually I don't vomit. That's why
Good
I
for you.
don't. Yeah, because I'm not drinking. I'm not drinking alcohol at all. That's why.
Yeah. Right. So there you go. Yeah, in English we have many informal words and even slang expressions. You can puke, yak, barf, heave. Now, of course, if you're talking to the doctor, like we're going to do later, you would probably use the more formal vomit or maybe throw up. Okay, talking to the doctor or in the hospital. These other ones are more slang for your friends. Puke, yak, barf, heave, boot. Okay. Or my favorite, pray to the porcelain god. If you can imagine what that means. Okay. Anyway, kind of disgusting, so let's move on. Heidi.
Yeah.
Okay, hi, how are you?
Fine, thank you.
Okay. I'd like to talk to you about sore and ache, actually both of these at once. What parts of your body can be sore? You can have a sore...
Sore muscle and sore throat.
Very good. Sore muscle, sore throat. Did you say another one? Did I miss one? You can have a sore back.
Sore back.
Sore shoulder, maybe. Sore knee. Whatever. Okay, many parts of the body. All right, Heidi, okay. English is kind of weird. We use sore for some parts of the body and ache for others. What are some...
Headache.
Definitely headache.
Toothache.
Okay, but it's toothache. I have a toothache. Even if it's many teeth, we say I have a toothache, by the way. Okay, any others?
Maybe even muscle ache, no?
Well, you can say...
yeah,
yes, you can say that. It's possible. You have aching...
Backache or...
Definitely. Now notice I'm writing all these as compound nouns because they are, and Microsoft Word is not correcting me because these are. Another one we haven't done yet, stomachache.
Stomachache.
Whoops, stomachache. Yeah, so all of these are compound nouns commonly.
Say stomach and sore stomach or.
Exactly. It would be weird. It's okay to say I have a sore back. But the other ones are sore stomach? No. Sore tooth? No. Sore is definitely more associated with muscles. Okay. Well, although throat isn't really a muscle. Well, kind of is a muscle. Involuntary muscle, I guess. Okay, but when I think of sore, I think more about muscles and aches about anything else. It'd be weird to say you have a sore head. Okay. Also, I should mention here with sore, Heidi, he is sore at me. Although this is a little bit dated, really. This is a common expression in the 50s or 60s. Rare now. But what does that mean? He is sore at me.
Sore at me?
Yeah.
Look with some feeling.
Not exactly. If you say he is sore at me, he's angry at you, but really angry at you for a specific reason.
Mm-hmm.
Oh, he's sore at me because I was talking with his girlfriend. Something
like sore memory or.
Yeah, well, yeah. It means resentful. It's angry, but angry for a reason, usually a specific reason. Okay, anyway, but we would never use that in the doctor's office to all these other ones that we talked about. Yep, those would be common. Okay, and actually these next two go together. Silas.
Yeah.
Have you ever had an infection?
I think so. Yeah.
Yeah, it's common. All right, what happens if you, for example, you cut yourself slightly and you get an infection in your cut? What happens?
You get a virus, bacteria.
Bacteria, probably, right? Right. That's right. Okay, and what happens? What are the symptoms? Another word that you're definitely going to use in the doctor's office. What are the symptoms that you might have an infection?
Pain.
Yes, it could be pain. Anything else?
Sickness.
Yeah, even nausea. Okay. It can cause sickness. Also, like a cut or a wound will often turn red. It'll turn red, and it might swell. That means part of your body that gets bigger. It swells. Okay, another word that we are often going to use in the doctor's office. Oh, I twisted my ankle and it's swollen. Swollen. Past participle or adjective. Swollen. Swollen knee. Yeah, so it might swell up, or it might get all red around the wound. Okay. It might even, this is disgusting, but it might even have there might be some yuck oozing out of it. Ugh. I know that's kind of disgusting. And then, Silas, have you ever taken antibiotics? By the way.
Medicines.
Sorry?
Medicines.
Sorry,
Drugs.
I'm not. Yeah, they're medicine. Medicine. I was so confused. First of all, in English, you can never say medicines. Well, you can. There's a whole lot of different types of medicines. yes, you can say it, but yes. Also, medicine by itself can be an uncountable noun to talk about medicine in general. Yeah, it's a type of medicine. That's right.
Mm-hmm.
Antibiotics, biotics. Okay, these you will hear slightly different pronunciations from English speakers. I think either is acceptable. What are antibiotics for, Silas?
To heal us.
Well, yeah, they're specifically for infection, actually. Infection either external, outside your body, or internal, inside your body. Whatever, you get sick with the bacteria inside, outside your body, either way. It's that's what antibiotics are for, to fight infection. Basically, they don't actually kill the germs. They just basically reinforce your own, get your immune system working better. Okay. All right. Moving on. Anna, have you ever had to take
Yes.
painkillers?
Yes, painkillers is a medicine to use in order to relieve a pain, for example.
Mm-hmm. Exactly. Another good verb here is to alleviate pain. Very good collocation.
Alleviate. Okay.
Right. Good one. Good collocation here. You want to alleviate the pain. Doctor, I need something to alleviate the pain or something to kill the pain. We actually use the verb in correlation with pain as well. I need something to kill the pain, doc. Okay.
Okay.
Right. What's the strongest painkiller you ever had?
Strong painkillers. Well, I don't know because I can't take any painkillers, but maybe when I was younger, there is some analgesic. I don't know how to say if it is correct in English. Analgesic, like aspirin.
Yeah. That's right.
I always had problem to swallow strong painkillers.
Ah, okay. Yeah, aspirins are also called the aspirin family, I guess. I don't know. Called analgesics. That's right. Same thing in English. That's right. These are mild painkillers, relatively speaking.
Okay, thank you.
Yeah. Yeah. Okay. I've had some pretty serious painkillers. I woke up in the middle of surgery and saw my foot was cut wide open. Ah! And I laughed. Ah, that's cool. Now that's serious painkiller. Wow. Okay, Saiban, what is the dosage? What does that mean?
A dosage is the size of a dose of medicine. So the size of dose of the medicine.
Okay, size of dose. How many and how much? Maybe both.
Yeah.
Right. That's right. Okay. Sometimes we say dose, but dosage is a slightly more formal, I guess. I don't know. It's weird. Okay. Let me quickly welcome a new student to the class. Hello, Dang, is it? Hello.
Hello.
Hi, Dang.
Hello.
Is that your name? Is your name Dang?
Hello. Can you hear me?
I can hear you. Can you hear me?
Yes.
Okay. Is that your name, Dang? Dang? Hi, I'm Oakley.
Yes. My name is Dan.
Okay. Very good. Nice to meet you. Okay. Welcome to the class.
Yes.
All right, I'll come back to you in a minute and talk to you in just a second. Heidi, have you ever had a rash?
Yes, I'm allergic to several things, so I have rash sometimes. Rashes are like our skin became red, and there are small volcanoes on the skin.
Volcanoes?
The volcano has some pus. Pus come out from that volcanoes.
That's funny. Okay. Well, maybe not volcanoes, but at least bumps or.
Yeah, small bumps.
Okay, I like volcanoes, though. I'm gonna leave that there.
Very, very tiny volcanoes.
Tiny volcanoes, yeah. More formal words since we're learning. How do you spell this?
Inflammation.
Inflammation, inflamed. I don't know how to spell that. Inflammation, yes. Inflamed, 1M. Your skin may become inflamed, meaning it's actually maybe swells a little, and it can even feel kind of hot to the touch. Skin might feel a little hot. Thus the flame. Okay. Yes. Okay. Why? Because she had an allergic reaction to something.
We have immune system. At first, it's very good, but again, some materials, immune system is too sensitive. Then suddenly they attack the owner's body itself.
Really?
Yeah. For example, I'm allergic to the pollen allergy. Then for several years, it's okay. Even foreigners come to Japan. They are very peaceful in Japan. But suddenly it appears because their immune system want to fight with the pollen. But pollen is not a bad thing, right? Like virus or not. So suddenly they attack the owner's body.
Oh, thanks for that. I didn't realize that's what an allergic reaction was.
I know about allergy very well.
I'm not allergic to anything, so I guess I never had to learn that. I did not know that. Thank you for that. Thank you. I have learned something today. Thank you very much. All right. I did not realize that. I'm allergic to nothing. Okay. Well, that's very informative. Silas, have you ever had sutures or stitches?
Yes, I had.
Okay. What happened?
I was walking and broke my left leg.
Left leg. You were walking and you broke your left leg. That's horrible.
Yeah.
You're just walking along and snap. Ah! That's it. Just walking.
Yes.
Not trying to kick a dog, not skipping, not jumping, just walking. All right.
Yes, I was just walking.
Horrible story. Wow. Okay. So what are stitches then?
A way to immobilize especially our bones to get healed.
Wait a minute. You're talking about a cast. You're talking about getting a cast. Okay. All right. That is the one to immobilize, especially bones, so they can set. You want your bones to set. Can't spell anything today. You want your bones to set. When bones heal, we say they set. So that's okay. That's a cast. That's the one we use for bones. So you got a cast. All right. I see. From dangerous walking. All right. All right. Well, that's definitely related. Dang, are you there?
I'm here.
Terrific. Dang, have you ever had stitches or sutures?
Yes, I have a hair. I have a lose it. I have a lose it. Please.
Okay. What happened? Why did you need stitches?
Yes, I don't have enough word to 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 describe.
Okay. What are stitches?
And uh,
Here's the key word.
uh,
So.
example. When you extraction teeth, you have to suture. You have to suture.
When you have a cut, a suture or stitches is to sew up tissue. If you have a small cut in your skin, they sew your skin back together, like sewing up clothes. They sew you back together. But of course, you can have sutures or stitches for other kinds of tissue inside your body or muscle tissue, whatever. But basically, they sew you up like you sew clothes, right? That's the idea. You get stitches. There it is. Oh, look, cast. Huh, was the last word. Okay, there it is. All right. Okay, and so we begin. Okay. I'm gonna let you guys now pay attention. Anna, you were first in, so we're gonna do this together, kind of as an example for everyone else, and we're gonna give everybody else a chance to be the doctor or the patient.
Yes.
We're gonna run through this role play. Okay. You can say whatever you want to. You are you. You're the patient. Doctor, obviously, medical professional, and the patient is the person who needs medical help.
Okay.
You guys, when it's your turn, you can just make up whatever you want to. You can be crazy doctors. I don't care. Okay. All right, Anna. Good morning, Anna. Please have a seat here. What's the problem?
Well, doctor, I've got a terrible stomach ache.
My goodness. Oh, very good. Yeah, I forgot about that. Do you have diarrhea?
Yes, I do.
Do you have any other symptoms? Okay, that's all we're going to talk about that. All right.
Yes, doctor, yes. I have a slight fever.
Very good. Slight fever, that means her temperature is slightly above normal temperature for the human body. She has a fever. Very good. And do you feel nauseous?
Yes. I do.
And when did these symptoms start?
It started last week. I don't feel well since then.
Okay. All right. Please take off your clothes to the waist. Put on this. Here. You can put on this gown. All right. You can put on this hospital gown and lie down there. Okay. Just tell me if it hurts when I do this. Poke, poke, poke.
Doctor, I have a great pain in my right side.
That's probably because I'm stabbing you with this pair of forceps. Okay. Maybe I should stop that. Okay. Well, let's hope it's just indigestion. We'll need to run some diagnostic, excuse my pronunciation, diagnostic tests to be sure. We'll run a blood test, and we'll also need a urine sample.
Okay. Can I take some painkillers?
No.
No.
No, not for indigestion. I'll give you a prescription for indigestion tablets.
Oh.
Okay. And the tablets, okay, specifically, they're the kind of hard, round pills or tablets. Okay, let's take a quick look at some of these words in here, and then you guys can try it as well. Diarrhea, bathroom problems, that's all I'm saying there. Okay.
Maybe I have to do a diet.
What's that? Change your diet?
A diet?
Maybe. A doctor, that's very true. A doctor may advise you that you need to change your diet. He may advise you to change your activities. You need to get some exercise. You need to relax. You need to somehow lower your stress level because you may have hypertension or high blood pressure. Yeah, a doctor, besides prescribing medicine, a doctor can advise you activities or advise you as far as your diet or liquids. They often, you need to drink more liquids. Okay, anyway, let's look at some of these words that, thank you, Anna, by the way, good job.
Okay, thank you.
All right. Some of these words, a doctor's always going to use this word. He's going to ask about your symptoms. She feels nauseous. She has a fever was one of her symptoms. All right, the bad things that you feel are your symptoms. Swelling, nausea, headache. Yes.
What does mean symptoms?
Well, exactly, I'm giving you examples. I have a headache, I have a fever, I feel nauseous, I'm dizzy, my left hand is numb, my knee is sore, all of those things. Anything that is not regular in your body health is a symptom. Okay?
Okay, yeah.
Basically, that means anything that is not normal for you would be considered a symptom. Saipan, if it's not normal for you to feel really, really happy, and suddenly you feel happy, then that would be a symptom.
Okay.
I've been really happy. Oh my goodness. Okay. What else did I want to talk about? Indigestion. Okay, if your digestion is the key word. You have indigestion, you're not digesting well. Either problems with your stomach, maybe from your stomach down to the bathroom, there's some kind of problems. The doctor's going to run diagnostic, why can't I say that today? Diagnostic test. He has to make a diagnosis. Okay, it's diagnosis, he decides what's wrong with you. That's my diagnosis is. Doctors will definitely use that if you go to an English-speaking doctor. Well, my diagnosis is that you have whatever. You have run through some poisonous bushes. Okay, diagnostic, the adjective, we know that because we can see the ending, IC. The adjective tests to help him figure out what your problem is. Very common to take tests. Doctor will take a blood test, a urine sample. This is very normal. Once he has made his diagnosis, what's wrong with you, he will often give you a prescription, an actual written form, which gives you permission or both permission in some societies and instructions on how and what medicines to take. So you can go to a drugstore or pharmacy, or British would say a chemist's, and you can get the necessary medicine that you need. You might ask him for okay, we have the diagnosis. The doctor may give his prognosis. You may ask the doctor, what is the prognosis? You're asking basically, well, for an estimate from the doctor about when will you recover, or what is your likelihood of recovery, or what the doctor thinks is going to happen to you. That's his prognosis. Okay, let's try this out. Think about a time when you were at the doctor's. Why were you there? What happened? How do you feel? And let's try this out. Okay, Heidi, I'm going to make you the doctor. Heidi, you want to be the doctor?
Yeah.
Or the patient?
It's okay.
Okay, Saiben, you want to be the doctor or the patient?
I think the patient, teacher.
Okay, all right, Heidi, Dr. Heidi. I like the sound of that anyway. Calling Dr. Heidi. Calling Dr. Heidi. Please come to the OR station.
Good morning. Please have a seat here. What's the problem?
Okay, we're going to get rid of this. You can say whatever you want, Heidi. You don't have to follow the script. You can say whatever you want.
Mm-hmm.
Okay, we're just going to get rid of that. Just think about when you went to the doctor.
But the first conversation may be the same. Good morning.
Oh, yeah, well, that's true. Yeah, you're right. Okay, go ahead. I'm sorry. I'm sorry. I won't interrupt. Go ahead.
Okay.
All right.
Okay. Hi, doctor. I don't feel okay. Yesterday, I didn't sleep well, and then last night I didn't sleep well. I have a headache, and I don't feel okay today. Even though that I drank a lot of caffeine, but I still don't feel okay, and my headache, it's really annoying me.
Do you have nausea?
No.
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 When has it happened? That your symptom.
Okay.
When your symptom had happened.
Okay, in my head, my headache.
Did happen better. I'm sorry. When?
Okay. When? Okay, it was this morning when I just wake up. For the first hour at the morning, I thought that it's just because I didn't get enough sleep. I didn't sleep well, but usually when I didn't, usually I sleep 4 or 5 hours. So my body is used to sleep at that much of time. But yesterday it's normal for me to. I mean, usually I have 4 or 5 hours, and I don't get headache. But this morning, I just feel that I have headache. I don't feel okay, even though that I drink the caffeine is not okay. So this morning, and it's tall, as you know, and it's right now it's evening, and I still have headache.
Do you have some nervousness? For example, you got broken up with your girlfriend or something?
No. I try, doctor, but it didn't work.
Mm-hmm.
I got enough, but it didn't work, doctor.
Because you said that you couldn't sleep very well. It came from your nervousness or some feeling, I guess.
As I told you, doc, that I usually it's usual for me. I mean, it's really normal for me to sleep every day, like every night, just 4 hours or 5 hours. But I don't know what's happened today.
Headache, maybe it came from the less sleeping time. So I think I need to find some reason why you couldn't sleep well.
I usually I really I have a really hard time with sleeping. I have when I go to my bed, I have to wait like 2 hours in my bed, and I just flip this side to this side, and I really have a hard time to sleep. Even though that I count the sheep, I drink milk, and it's really hard for me. I don't know what which way will be work with me, but I have really hard time to sleep. I don't sleep. I mean
Are you
easily.
are you a student or do you have a job?
Yeah, I am student. Yeah.
Mhm. Do you have some hard times about your study?
Yeah, I have especially that day, this day, I have final test, the final exams. So I usually I usually um, stay up until 4 morning or 5 morning.
Maybe you should sleep well at first. So I will give you some medicine. I describe some
Yeah, but
medicine
yeah,
for sleep.
okay, yeah. So okay, I would
Sleeping well.
like.
Yeah.
Yes.
Okay. All
Okay,
right.
thank you.
Thank you. Okay. Okay. That was interesting. All right. Very good, Heidi. I think you got to the root of his problem there. Okay. Let me give you some feedback. Let me walk through very good job, both of you. Excellent. Let me give you a little feedback and add a few vocabulary words or some English. First of all, Saiban, I notice all through your conversation, you need to be careful with the long E sound, like
Okay.
caffeine. I
Caffeine.
feel. I count sheep.
Okay. Sleep.
Sometimes
Okay.
it comes through as a much shorter sound. Caffeine, fell, ship. It's E. Stretch your
Okay.
mouth, your
Sleep. Okay.
lips. E. Smile when you say E.
Mm,
Okay.
okay. Yes. Sleep.
Uh,
Okay.
all right. Um, that was funny when I don't know what Heidi asked you, but you said I don't know. She said, where does where does it hurt? My headache in my head. Okay. Anyway, whatever.
Yeah.
Couple
Very.
couple of prepositions. And an hour at the morning should be in the morning.
Okay.
Okay.
In the morning. Okay. Yes.
Okay, it's a little confusing in English, all right? We say in the morning, in the afternoon, in the evening. For
Okay, teacher.
some stupid reason, we say at night. Don't ask me
Okay.
why. I don't know why.
Okay.
One exception, at night. We use in for longer periods of time. In the 1970s, in July, in 1992. Yeah, the at night thing is a weird, I don't know what it is. I can't explain it.
Yes.
Anyway. Okay. Going back to Heidi. Okay, you asked if he had any nervousness, and that's fine. There's nothing wrong with that. But a doctor would typically ask you about stress. Have you had extra stress in your life? Is there anything? You might say nervous. Is there anything you're nervous about? Also, just because it's related to headache, and that was his main symptom, here's a term, a migraine. Somebody has migraine headaches, for example.
Yes.
Yeah, this is I guess, fairly common thing.
Very strong headache.
Very strong headaches, and they're usually triggered by something. I worked with a girl. She loved bacon, but if she ate bacon, she would get a terrible migraine headache, and you could tell it was ridiculous. she would eat one piece of bacon, and an hour later you'd have to send her home from work. She could barely walk. She could barely talk. I don't know. It has weird triggers. Things that start something. So if you're allergic to peanut butter triggers a reaction. This is also common in talking about medicine. So anyways, I guess usually something triggers a migraine. I don't really know that much about it, honestly. I'm not a doctor, but okay. Another thing, Heidi, you might want to, okay, earlier, somewhere in this lesson, we talked about, what did we say, a running test? Run, okay, there it is. Run some tests. All right. I don't know, you might want to have thought about running some tests or something. Okay. And, okay. All right. Okay, we're going to run some tests. When the doctor says that, oh, we need to run some tests. But if he might tell Saiban, you need to take, you need to have, not take a test. You take a test like in school. You need to have a blood test. You need to have a whatever. You need to get your blood pressure checked, maybe.
Okay.
All right. Well, I'm not just telling you. I'm telling everyone, actually. But I am telling you, Saiban, and everyone. You said, oh, last night I was flipping from side to side to side. You were tossing and turning.
Okay, tossing and turning, okay.
I was tossing and turning all night. Here's a good phrase that we commonly use to describe that.
Okay.
4 in the morning.
4 in the morning. Okay.
Yes, in the morning. 4 in the afternoon. We commonly do that to make it clear. Oh, it was 4 in the morning. It was 4 in the afternoon. It was 7 in the morning. It was 7 at night. 7 in the evening. All right. And I guess, Heidi, you might have just, I think you said described by accident.
Yes, prescribed. After that, I got, I made mistake. Yeah.
Prescribed. And commonly, I know these have a more formal name, and I'm sorry I can't think of it, but colloquially, more informally, you might, I think you prescribe some sleeping pills. I know they have obviously everything in medicine has a more formal name, but I don't remember what it is. Okay, Silas.
Yeah.
Have you give it a try? Would you like to be the doctor or the patient?
I'm not sure. I don't want to be the doctor.
Oh, you don't? Okay. Okay. Dang. Are you there? Hi. Are you ready to try to be the doctor?
Okay.
Okay. You're the doctor. Your patient is Silas. All right. Go ahead, doctor.
What's the subject?
Okay. Good afternoon. Please have a seat here. What is your matter?
Good afternoon, doctor. I don't feel good. I was walking around the first square and I think I broke my right leg.
Okay. How long have you been? When did the accident start?
In this morning, I was walking around and I broke my right leg. It hurted, red and swelling, as you can see. I think you can help me.
Okay.
Maybe with some suture.
Do you you have any other system?
Yes, if you can help me with some medicines to alleviate my pain.
Ah, yeah. Waiting for that.
Have you take CT film?
A what?
Have you take CD film? CD film.
Acetaminophen. Are you saying acetaminophen?
Yes.
Okay, like aspirin. Silas. I don't know how to spell
Yes,
it.
thank you. Are you gonna prescription me that?
Yes, I think
Okay. Prescribe. Okay, we're running out of time, so prescribe, Silas. Are you going to prescribe that to me? The verb is to prescribe. The doctor prescribes medicine.
So, doctor, are you going to prescribe me some medicine?
No, he prescribes medicine to you. He doesn't prescribe you. So, are you going to prescribe medicine for me? And it would be for me. Because we use the preposition. Hang on, hold on, guys. I'm going to give you some feedback now. You prescribe.
Okay.
The doctor prescribes medicine for you. We use for in English to show benefit. I've got a pencil for you. I want to give it to you. Give it to you just means transfer, but for you means to benefit you. So obviously the medicine is beneficial. So it would be common. Are you going to prescribe some medicine for me?
Sure.
You can use to me. It's possible, but okay. Dang. Make sure that you're finishing. You do the end sounds of words, especially the important words, like please. Don't forget the z at the end of please.
please.
Thank you.
Please.
And you said, what is your matter? How about what's the matter?
What's the matter?
More politely, what seems to be the problem? There's a more polite way.
What seems to be the matter?
Yeah, okay. What seems to be the matter? What seems to be the problem? Okay.
Okay, thank you.
All right. And also, if somebody broke their leg, you wouldn't say, when did the accident start? In fact, you would never say, accident start. Almost never would you say that, because accidents are very fast. So when did the accident happen? All right. Accidents happen. Okay. And also, dang, symptom.
Symptoms.
Much better. Okay. Right. The things that go wrong are your symptoms. And Silas turned red. The past tense of turn is turned, not turned. Turned, one syllable. Okay? Turned red. Okay. Very good. Thanks a lot. Thanks, guys, but we're out of time. Tomorrow we're going to do another role play class at this time, so I hope you can join me. I have to go. I have another class right now on Verbling, so thanks a lot, guys.
Thank you very much.